Hi, this is Maureen O'Hara, one of the PAs that works for Dr. Chambers on the ODA service. And I want to go over some of the admission order forms that we have. So you've looked up and found out where the admissions are located. You've looked in chart view to find out some information about the patient. Now you're going to go see the patient and complete the orders. So I just want to point out that the E is our access to the intranet, which is where all of our forms are located. So if you click on Internet Explorer and then scroll down and click on, Forms, and then you open up another menu and click on Nursing, it will open to these pages here, which is in alphabetical order, and most of the forms that you're going to be using are under diabetes amputee something. So here is the admission note here. Here's the admission orders, daily progress note. These are for surgery, the post-op check and the op note, dressing change orders, heart and lung note, and PO orders. Over here we have the MRI forms. There's going to be one that you'll be interested in that was not available when I took this screenshot. It's called, it's under physician orders, and it's inpatient MRI foot, I believe it's called. And then you'll want this one, the lower extremity scan, which you need, or the MRI people will not schedule the patient. Here are some other ones. Post-discharge care instructions, ODA has their own, and the transition to community forms to make appointments, and ODA has its own. Okay, so here is the ortho admission orders. You need to put in your name, your pager number, just a general diagnosis of the patient, like this one, right great toe infection, what kind of allergies the patient has, how much the patient weighs. That's why you need to know that from the nursing note. And then you want to check off the medication reconciliation. Usually you talk to the patient and ask him or her if he has any allergies, so you can check that off. And then usually if the patient is admitted overnight, somebody has written for some kind of narcotics, so you may or may not need to write for that, but if you do, here's some that you can order. I just want to remind you that tramadol is, or Ultram is contraindicated in people with history of seizures, so that's why you want to check that off. Also, if the patients have renal problems with creatinines over 1.2, you either need to increase the interval of time or half the dose for the clearance. I think the formulary is phasing out Vicodin and starting to use Norco now. So you can pick Norco 10 as the one I think they have. I believe they have the 5 as well for the little old ladies. So what you can do is if someone has renal problems is you can give them 5 milligrams every 4 hours, or you can give them 10 milligrams every 6 hours. You can titrate it that way. Same thing with the morphine. You want to be sure and give them something. The nurses prefer IV, but you certainly can order IM if you like. And this is a fairly routine dose for the 70-kilo man. I'm going to stop here and pick up with the orders in my next segment.